Hi, I'm Jack, and today I'm going to be discussing about a condition called exertional rhabdomyolysis. The case we're looking at today is a 27-year-old male. He trains 5 times per week, so he's highly active in the gym and also in his spare time. In the past 6 months, he's completed 10-kilometre runs and also 3 triathlons in quick successions, completing them in May, July and September. His main focus has always been endurance-based activities, although he did spend 2 months in the gym practicing his lifting technique. We're now going to have a look at just how exertional rhabdomyolysis affects the human body. Rhabdomyolysis is a condition that affects the kidneys. What happens is muscle fibres will get damaged, which release compounds such as myoglobin, which enter into the bloodstream. This is a direct effect from excessive amounts of exercise. So from the case study, we can see going 5 times a week may cause this due to the prolonged amounts of exercise that he is doing. The kidneys start to break down due to the high levels of myoglobin, which prevents the production of urine. From this can cause serious dehydration to the body due to him trying to hydrate from the gym, and then the lesser amount of urine coming out of his body. The more fluid he then puts into his body, it's going to cause more damage to the kidneys due to the fact it's not being able to flush out. We're now going to have a look just how rhabdomyolysis will affect the body. We can see some of the side effects here. Like I said, a dark coloured and lack of urine coming out of the body from an infection to the kidneys due to the high levels of myoglobin. We can also see an abnormal or irregular heartbeat. This is also an effect of exercise due to high levels. Nausea and vomiting is because of severe dehydration. So not being able to flush out urine from the body is a big effect, because he's trying to put fluids into his body to rehydrate, but because it's not being able to flush out, then the dehydration is just going to get worse. The high levels of potassium to the bloodstream is an effect of the myoglobin. So from this we can see that the muscle fibres break down and release these compounds into the bloodstream, and this goes to the kidneys and can also go to other areas of the body. The fever, confusion and loss of consciousness. This can also be an effect of dehydration. It affects the brain as well as the kidneys and other areas of the bodies. It can leave people dizzy, feeling sick, and also just not feeling good on like a day-to-day basis. We're now going to have a look at the etiology and risk factors of rhabdomyolysis. So the case study we spoke about earlier, the 27-year-old guy, he was both doing aerobic and anaerobic exercises. The aerobic obviously is triathlons, is swimming, but also he said he was doing his lifting techniques, which are anaerobic exercise. So the direct effect of this could be from too heavy weights. The body wasn't able to sustain the pressure being put onto it, which may cause rhabdo. Age also may have a role in it. On the case study we saw, he was only 27, and we saw another case study where the girl was only 21. So it could be an effect that causes younger people to have it more. In the case study we saw the 21-year-old girl do 143 bicep curls. So whether repetitions may have an effect on this, it could do. She may have been doing muscular endurance exercises, which is low weight but high repetitions. This helps just keep hypertrophy in the muscles really. And the body may just not been able to handle it. It may cause excess pressure on the muscles, which can release the myoglobin, which then occurs for rhabdomyolysis. Full body weight against singular exercises. We saw the 27-year-old guy was practicing lifting techniques as well as training anaerobically, so there isn't really a direct correlation there. But the 21-year-old girl was only doing singular movements, and that caused it. So really, any exercise can make it occur, really. As we've seen from both, there are different types that have caused it. We're now going to talk about the diagnosis for rhabdomyolysis. And the main thing to do really is weigh up the symptoms. So we saw the symptoms previously from the figure of what they may be affecting. The main thing you're looking out for is tenderness, pain and swelling from any muscles. Another thing you could do is ask the patient for blood and also urine samples. From this you'll be able to test the levels of myoglobin in the blood, high levels of kinase, and in the urine you'll be able to see the colour of it. It may be described as Coca-Cola coloured. You can also ask them about the muscles that have been affected. They will be in extreme pain in some muscles. So if it was the 21-year-old girl, she'll have greater effects in the bicep and also tricep area. From using bicep curls, you can see that they are going to be the affected areas most definitely. She may have some shoulder pain from global regions, also pain in the wrists as well. If it was in my clinic, the immediate thing I'd ask for, and it's subjective, is just how long has it been since you started feeling the effects. Ask them about the affected areas, where it is, what exercises they were doing, whether it's anaerobic or aerobic. Ask them about repetitions, see if they took any heart rate things. Other than that, a thing for them to do for me is take a urine and blood sample test. From this you can test the high levels of kinase and myoglobin and try and get a full diagnosis for them to see what the problem is. So the symptoms we saw the case study have was leg cramps. This was from his aerobic, so he did a lot of running, he did a lot of swimming as well. So just too much of that just causes cramps around the hamstrings as well as the quads. He had difficulty walking, this because of the DOMS, the delayed onset muscle soreness. So it won't happen straight away. It will just be a build-up of lactic acid, and the way to really get rid of it is doing a proper warm-up and cool-down, making sure that you're cooling your muscles off and that you're getting that lactic acid shift out of the muscles and just enabling them to cool down properly. He had the dark coloured urine, described as Coca-Cola coloured. This was just from severe dehydration, really, the lack of production of urine. He couldn't walk after being in hospital. This is a really important one, because when he was in hospital, he would have just been lying down having all his tests done. But because of the lack of mobilisation going through his legs, the muscles would have just seized up. So you'd see more like rectus femoris in the quads, just really seizing up. Also in hamstrings as well, your semi-10, semi-membranosus, just both coming really tight, and this can be really painful for the patient as they want to get mobility back into the legs from it, but when you've really been immobilised from this, it's hard and you do have to get a good treatment plan. The symptoms start over the next 24 hours from the injury. So it starts off with your obvious muscle pains and swelling. That is just your muscles, really. From that, it develops into your dehydration. So after exercise, it's really important to keep hydrated. But because of the lack of production of urine, it becomes a more increased process as you're putting more fluid into your body and basically nothing's coming out straight away. Research mostly says that all the symptoms are the same, so the most common symptoms you see from different papers are the extreme soreness from the muscles, as well as the Coca-Cola urine through hydration. So a secondary problem they may face is called compartment syndrome. Compartment syndrome is basically just an increase of pressure levels around certain parts of the body. It's usually found around muscle areas, which can leave permanent damage to the muscle fibres and tissues. Surgery is required to relieve the pressure from the areas, but that doesn't 100% cure it really. due to the damage that has been caused to the tissues and fibres. Another thing is dehydration. Obviously this is linked to rhabdomyolysis. This is an effect of repetitive eccentric load, and another thing is it does cause hypothermia to the body. Overuse, so working out too much, linked to the case study. He works out 5 times a week, could be too much for the body just to handle. Dehydration, another one. Obviously we spoke about the Coca-Cola coloured urine. This is linked to his aerobic exercise. May just be doing way too much, and it's just affecting dehydration. He's putting the production of urine not coming out of his body, he's putting too much fluid into his body. It's going to have an effect on the kidneys, and eventually that does cause the dehydration to become worse. So here we can see a picture of what compartment syndrome surgery does actually look like. So you can see here that he has had surgery around the gastroc area, and the surgery is just basically a cut open, and that just basically allows to relieve the pressure away from the gastroc, and it basically heats up like a bubble really, so getting the air out of this relieves any pain and swelling. Now I'm going to look at some ways of reducing the risk of rhabdomyolysis to the body.